Thank you for joining in person, and hello to you who are online this morning. I'm Mike Dell, I'm the Vice Chair for Education, and it is my great pleasure to welcome Allison Remy to the podium this morning. Before I introduce her, I just want to signal how much this topic resonates with me. I do a lot of recruiting to peds. I talk to a lot of students about why peds, listen to their stories about why or why not peds. And one of the things that I hear from them, among many, for those people that really love kids, is, in fact, I think I love kids so much that I can't stand to see them sick, or, oh my God, the thought of ever losing a kid is terrifying to me. So I routinely tell them, I think that we have the highest of highs. You save a kid, like, could you possibly have a better day than that? Or even on the days that I think sometimes we under recognize, where you did something that just had a positive impact on the life of a kid, and how much that is going to pay off, hopefully for decades, because you made their life or their health just a little bit better now. So I think that is our superpower. It's part of the calling of pediatrics for those of us who believe that it is more than just a job, but it's partly a calling. So, but it is very tangible how much we as a community suffer when we lose a kid. I think appropriately. I don't ever want to work here in a time where that stops being a really big deal. But to see that when Claudia Hoyen reached out and asked about it, inviting Allison to talk to us this morning, that was a pretty easy and instant heck yes. This is a really important topic. So who is Allison Remy? She is the Joni and Tom Adler Endowed Director for Patient Bereavement Programs. She is trained as a social worker. She grew up here in the Northeast Ohio area. Got her undergraduate degree from Bowling Green University, and then her master's degree here at Case. Followed by, I believe, her first professional job here at UH. She was still working with adults at the time, and in fact, for the first several stops of her career, I think was focused mostly on adult social work. But after leaving Cleveland, spent some time in New York at Mount Sinai, some time in DC at the Washington Hospital Center, and then moved just up the road to Bethesda, where she worked at the NIH. Moved back to the Midwest, but overshot Cleveland by a little bit, working in St. Louis for a few years. But I believe it was there that she saw the light and turned her attention to pediatric social work. And we are thrilled that that in 2022, she came back to Cleveland, came back home, and joined us here at Rainbow again with her directorship. So at this point, I will turn the podium over to Allison. Looking forward to your talk.
All right. Morning, everyone. Thank you, Dr. Dell. That was a very nice introduction. So just a little tiny bit, I wanted to kind of give a little background as well as a shout out to Joni and Tom Adler, who actually made my position a thing. So they actually made a very generous donation to create someone who could oversee all of our parent bereavement. So I work a lot in McDonald Women's Hospital as well as in Rainbow. I didn't bring a lot of numbers because it is a little bit overwhelming, but there's definitely a need there. So they actually lost their first grandchild. He was born still about 18 years ago in Boston to their son, Bill, and daughter-in-law, Cheryl. And not only was that a horrible thing that happened because they lost their grandson, but it was a terrible experience. They didn't feel any sort of care or compassion from staff. In fact, if you talk to them about it, they can actually tell you, you sat on a radiator in a hallway and no one even really said anything to us. So I take from that I personally cannot change an outcome for a family. By the time I'm involved, someone has called me, someone has made a referral. I can't do anything about the outcome. Also, social worker, not medically trained. But I can help change an experience. And that's what I want to talk about today, is changing that experience for our families when we are getting to end of life and bereavement. So how do you build a bereavement program? Well, a lot of coffee, a lot of, experience behind me, and then just a really good attitude to try to change this experience for our families, which a lot of this is already happening. But how do we continue to support staff, educate staff, and support our families and our patients? I also want to recognize that a lot of the families that we take care of also have siblings, and we will talk about that today. I want to make sure our families feel comfortable coming back, right? Because they have to still get care for their other children if they have them. So that is also very important. I don't want them to feel like my child died here. Now I need to take all of our care somewhere else because I can't come back. More often than not, families actually do want to come back. They want to stay with their provider that they know cares about them. So please all remember that people actually do want to still see you, and they do still want to be connected if they have that positive experience. So we are talking about a lot of heavy things today. I want to acknowledge that. If something hits a little bit too much, please feel free if you need to step out for a minute. I also did throw a basket of Kleenex in the back. Hopefully no one will need them, but if you do, just want to give everybody a little bit of space for that. Also happy to follow up and talk with anyone afterwards. So we're going to talk a little bit about strategies for caring for our lost families as providers, because this is heavy, this is hard. The importance of helping families to create continuing bonds, but also our bereavement follow-up for our lost families, right? So how do we care for them while they're here, but how do we care for them after they leave and they go home, which is why I'm here. So just a few quick definitions for everyone. I will say that clearly we are talking about end of life and bereavement today, but you can feel loss over a lot of different things, right? Anytime a family has a child that has to get admitted to the hospital, that can be a loss, right? That's not something someone expects to come in and have to have their child in the hospital or in the ICU, in the emergency room. So hopefully some of these things you can also just apply to like real life and not just end of life. Grief, that's all those things inside that we hold in. Those are all of our own personal feelings. And mourning is that outward expression of our grief. And bereavement kind of just sums up all of the things. So while we're talking today, these are some questions just to kind of think about. Not necessarily I'm looking for answers, just some things to think about while we're talking. So what is the reality of loss? How does loss impact us? Why is it so hard? How do we cope? How do we manage stress as healthcare professionals? What can help us? How do we care for ourselves? And how do we help support others? I think this is really important because this is hard work. And we need to admit that to ourselves too. So what do we bring to each encounter with others, right? Because while we don't always know where our families are coming from, they don't know where we're coming from, nor do they need to know where we are coming from, but something that we need to recognize in ourselves so that we can help them, right? Because we have our own expectations. When we are hearing about, a new referral or walking into a new room, what are our expectations for what we're about to encounter with a family? What are our feelings, right? I don't know about everyone else, but I have a lot of feelings. I also like to outward process. In case you can't tell, I am a big talker. But it is helpful to be able to name our own feelings. Again, not in front of our patients and our families, but whether you have, a work buddy or, a really wonderful significant other who will listen to you, or, a best friend or mom or dad or whoever that person might be for you. It's somebody that you can express that to. What are our motivations, right? So what brings us here? What brings us to this place? Why are we doing what we're doing, right? Everybody has a reason why they are here. What are our intentions? So when I'm going into a room, what am I trying to accomplish? Right? Which may or may not happen, but why am I actually trying to walk into this room and meet with this family? But also our past life experiences, right? So there might be some of us in this room who have our own loss experiences, and maybe we have some that don't, and either of that is okay. That's something to recognize. So when you're walking into a room, we can check that at the door, right? Go and do what we need to do and pick that back up when we leave. This is my favorite depiction of grief. It is probably in every single presentation that I have given. So in case anyone sees it, yes, you've probably seen it before. So Elizabeth Kubler-Ross never meant for her 5 stages of grief to be a circle and to be something where people, hit them in a particular order at a particular speed and just, go around. The last thing I would ever want to do is tell someone that they are grieving wrong. You have met one grieving person. You have met one grieving person. I have had over 400 referrals since I've been here, which is 2 years. None of these people react the same. And even when you have a family, right? You might have a mom and a dad that are completely different in how they react. So this is not something to memorize. This is like literally someone probably drew this at a conference and then other people took pictures, right? And it ends up on social media and it's super popular. But I want to throw it out there so no one thinks that, okay, someone is now in anger and they'll get past that and they'll go here and they'll go here. That's not how it goes. It's all over the place. And it's something that you learn to carry with you the rest of your life. So the death of a child could really be the worst thing that can happen to a family, right? I think even, Dr. Dell said that when you're talking to someone, like, this is not something any of us want to have to deal with our families or with our patients. No one wants to lose a patient, but it happens. And this is something that is extremely traumatic for siblings, for parents, for grandparents, right? The entire family system. So when we have a family come in, sometimes we know them and we know them really well and we know what they're coming in with, right? What's going on at home. Sometimes we don't. And some of our families come in with a lot of these risk factors already. And so adding the death of a child on top of it is even more traumatic. So what can we do, these like bottom blue arrows, to help protect them a little bit, right? Because I can't fix what's happened to them, but what can we build in? Do they have a good support system? And not only do they have a good support system, but is it a supportive support system? I never want to assume because I walk into a room and there's 40 family members, that those 40 family members are actually still going to be there in the next few days or the next few weeks. I recently did a home visit with my student, and this was a family who suddenly lost their daughter back in February. She came in, was really sick, ended up septic, on ECMO. It was bad. She died within a couple of days, and they had, I want to say, probably at least 24, 36 family members that were coming in and being with them and talking with them and sitting with them. So the assumption from that would be, look, this is a family, like they have the support, like they have the people that will be there for them. So I've been in contact with this dad, helping find counseling and support groups, and also for their son who, is struggling with the death of his sister, and sat down with him a few weeks ago at his house, and he shared that he actually hasn't spoken to his family since that day. They just haven't been there. They showed up late to her funeral, and directly after the funeral, they actually all left. They went back to their own lives, and once in a while might like send him a message, and that's it. So here's the assumption that, look at all these family members, like they'll be okay, right? They have the people to lift them up. So that's what I'm saying when I'm talking about supportive support, not just the people who show up in that moment, but the people who are going to keep showing up, right? Whether they're there to listen or to talk, or they're there to do, right? Because sometimes you need that person too that just shows up and, makes you a meal or runs your vacuum for you. So what are things that we can continue to do to kind of increase these protective factors, right? So that we don't have these families that kind of just fall off this cliff and can't get lifted back up. I will say, obviously, this is in general. So when you do have families where you have that family unit, right? Like, how does that work for those relationships? Because any relationships that already have some cracks in them, losing a child typically is going to break those cracks even more, right? And so we see that increase of divorce in parents who have lost a child. Oftentimes because they grieve differently, they don't always talk about it, right? So if I'm sitting in a corner crying and my husband is off taking a walk, right? I might assume that he's totally fine, where that just might be what he wants to do to work through his grief. You might have a dad that goes back to work right away and a mom that doesn't, right? And the mom is assuming, I don't know how you can get back to your schedule. And the dad, that's just what he needs to do. This is very stereotypical. So just for generality's sake is where I'm going with this. Being able to actually talk through those things, right? Like, let's set aside a time once a week and actually talk through this, right? This is what I'm feeling and this is why, and being able to hear that from both sides. Also being able to say, this is what I need, right? So if I'm sad, maybe I need someone to just listen and I need to vent about it. And I don't actually want you to say anything back, but maybe I'm the person that really wants advice. But how do people know that if you don't say that? So encouraging any sort of communication. The number of times I've actually jumped on a phone call and got put on speakerphone or on a Zoom and kind of done this like in real time with a couple. It's also much easier for me to do it in real time with a couple so we can talk through it together and kind of like mediate basically what they're saying to each other. It's really hard. Another big group, and this one I definitely want to highlight because regardless of where people are in the hospital system, you are going to encounter siblings at some point, right? So whether you are the person that is taking care of a dying child in the ICU or in the emergency room, or you're the pediatrician in the community, there's going to be siblings, right? And they have to come back to see somebody. So this is not something that is going to just never affect anyone. This, even if you're not the person taking care of the dying child, you're still going to encounter the siblings. And this one's really hard. This is the one that I get asked about a lot. What do I do? How do I tell my other child, my other children, that their brother or their sister is dying or has died? Right? And there's no right or wrong way. A lot of times if I'm involved, it's some information finding, how old is your child? How old are the other children at home? What's kind of like their learning style? Is this a kid that really likes books? I have books, right? Is this a kid that we need to be a little bit more creative and call some of our other friends in the hospital that could perhaps help with that, right? Kids are a lot of times way more expressive than us if you want to talk about art therapy, right? Or music therapy. So being able to pull in some of our other disciplines to help with this, that is really hard, but also our need for age appropriate interventions. Because the family I worked with yesterday that has a 3-year-old and has an 8-year-old, that's totally different for each one of those kids. What I'm going to help you with your 3-year-old is going to be different than what I'm helping you with your 8-year-old. Especially if one of them is asking a lot of questions and the other one isn't. How do you explain that? But you need to talk to your sibling. They're going to know that their brother or sister is not coming home. So being able to tell them that in age appropriate ways is really helpful. Again, calling for help, right? So calling for a child life specialist to come and help you with that and work with you, asking for an art therapist, music therapist. The pediatric palliative care team has a really wonderful art therapist, asking for our chaplains to come by. I really like the pet pals. I don't know if anyone else likes pet pals, also just for staff purposes. I'm going to be really honest. I will call them for myself, but calling them for a family that just might need a little bit of extra compassion and extra love. Siblings are also difficult because when I'm talking to this family yesterday and I'm talking to them about their 3-year-old and their 8-year-old, what about next year? Right? There's a big difference between the 3-year-old and the 4-year-old. What about in 2 years? This is a conversation that is going to be continued. So how do we continue to help with that conversation by putting those good building blocks at the bottom and building on that foundation? So we work in a hospital, right? And people die. Clearly, on the adult side, this happens a lot more and a lot more often. Doesn't happen as often over here, thank goodness. But when it does, it's terrible and it's really hard to deal with. But parents and families, they don't know that. They don't know if this is the first time you've ever cared for a family who has had a child die, or if it's your 50th. They don't know. They're looking at us to be the experts and to help walk them through this horrible thing that is happening. No parent should ever have to make choices of what to do when their child dies. No parent knows how to find a funeral home and call and make arrangements for what they might want for their kid. And know what's okay and what's not, right? Do I have to have a traditional funeral, or, can I jazz it up and play like their favorite music, which might not be okay to play at church, but this is an instance where it is. So remembering that we have this great opportunity to make a child's last moments, hours, days, sometimes weeks, a more positive experience for these families, because this is a time that they're going to carry with them for the rest of their life. That's something that they can look back and say, Rainbow really cared about us. They really cared about my child. They gave us the time that we wanted with him, with her. That's something special that we can really do. So this is my only slide with numbers. So 2024 is not done yet. I don't have those numbers up there. I can rattle them off, but just sometimes I think it's hard to put in perspective when, you've had a really bad month, right? And you're like, oh my gosh, this happens all the time. Or last month was actually, now that September is over, I can say we had one child death in the entire hospital. It's sometimes it's a month where it doesn't happen, and other times we get hit really hard. So just kind of put it in perspective. I know I don't have it pieced out by diagnosis or anything like that, or by age, but it'd be helpful kind of look at. I will say the one difficulty prior to Epic is actually being able to pull all of that information from our pediatric deaths and all of our UH outside emergency departments. With Epic, I've been able to pull that. And so we're actually starting to put in some programming for all of our pediatric emergency room deaths. So whether they are here at Rainbow, we had 23 last year. This year we are up to, I want to say 14 in our PED, but from October 1st of last year through now, we've had 19 in all of our other UH facilities. So those are programs that we're going to start putting into place. How do we help those families? So how do parents respond? Right? And let's be honest, parents that have their child in the hospital, sometimes are lovely and sometimes are really difficult. But all of these feelings, when your child is dying or has passed away, are okay, right? We have the families that come in. I've had moms that are just on the floor of the ICU sobbing, right? But I've also had the parents who are just in complete shock, and it almost looks like they have no feeling whatsoever because they literally can't process what is happening. For anyone else who is a parent, feelings of failure and guilt, I think that's like almost just built into us once we have a kid, that you just start feeling like guilty for any sort of thing that happens, right? I gave my kid the wrong color of cup when they had their breakfast, and now they have told me I'm the worst ever. So this is completely amplified when something happens to your child. Did I do something wrong? Did I not take them in soon enough? Should I have called the pediatrician sooner? What if I had shown up in the emergency room a day before? These are questions that I hear all the time. It's not always questions that we can have answers to, right? But I can listen and talk through that with someone, because they're trying to find a cause. They're trying to find a reason, like, why did this happen? Because sometimes we don't always have a reason. And when that happens, we go back to the guilt, right? Well, if there's no reason, like I did something wrong, right? Anger. I feel like this is a very common emotion, and it's not necessarily anger at us. Sometimes it definitely feels like it. Sometimes it's just anger at the situation, right? At the world, at the universe. And those are hard too, especially when you have that family that is to the point of being belligerent at you. That is hard, because a lot of that is mixed into grief. I think denial we see too. I think sometimes that's when we have those children that we know that they're not going to make it, and it's like a days or weeks, or I think unfortunately sometimes months long process of that family kind of, as we view it, coming around, right? And seeing what's going on. It's hard because you don't want to extinguish someone's hope, right? Sometimes that's all anyone has left is hope. And even if it doesn't make sense to us, and maybe it's not even realistic hope, it's still hope. So to us, it might look like denial, and that they don't believe what we're saying, or they don't think what's going to happen to their child's going to happen. They're just holding out for, that miracle, because maybe you've heard of that happening. So for us, it's also important to remember that, again, this is a time this family is going to carry with them for the rest of their lives. So what can we do to show our care and our compassion, right? What can we do to really support this family the best way that we can? I'm going to talk about this in the next couple of slides, but being able to give choices for a family, right? I like to ask a lot of questions, like, can you help me understand how to best care for you and your family? Has someone in your family ever passed away? Have you ever been to a funeral, right? Because right there, I'm getting some information, and I know kind of how to talk to this family and what they might need, right? The grieving family doesn't know necessarily all of the things that they need, but I can ask enough questions that I can kind of help figure out what they might need. So be inquisitive, right? The worst thing a family can do if you're asking a question from a good place is say, no, thank you. I don't want to answer that. I don't want to talk. I will say the majority of the time, if you ask them about their kid, it's usually a safe space, right? Maybe this is a child that we don't know very well. Maybe they can help share. Maybe they can tell you some funny stories. Maybe they can show you some pictures, right? I've walked into a room and been with a family and looked at, a traumatic situation, and I have no idea what their child actually looks like. They're usually very willing to share and to talk about some of those happy memories, which might seem a little strange in these situations, but sometimes it's a nice outlet for that family. And they know in that moment that you care about them. So things that families need in these situations that we actually can help give them. So choices, language, and preparation. Choices, when I'm talking about them, usually are more memory making or legacy building. Is this a family that we can offer to do some handprints? Is this a family we can offer if they want siblings to come in and we can have child life, work with them on what they're about to see and what's about to happen? I think there's a lot of other choices as well that we can offer, right? Is this a situation where can we offer if right, an oncology patient doesn't need to be in the ICU, are we able to offer that they go to a regular floor or not? Right. And those aren't things a family would know. Those are things that we would know. And if they're appropriate, is that something we can offer? Language. We're going to go through a few examples of this because this is like the most common question that I get asked is, what do I say to a family? How do I do this? And then preparation. So what to expect? What are they going to be seeing potentially? What might they hear? So those are things that we can help with. So if we're communicating, right? We have an opportunity to pull up a seat, and I know things get busy and it's not always possible. If I can pull up a chair for 5 minutes or stand over somebody for 5 minutes, which one are they going to think that I'm in the room longer? Right? If I'm sitting, there are plenty of studies that show that, even if it's the same amount of time. But being able to sit, being able to listen, right? For any of our residents that did the communication workshops last year, we talked about this a lot, right? Sitting and asking, please help me understand, what you've been told so far, right? Because it might be that we've told them everything, but they haven't heard anything. So please help me understand what have the doctors told you so far so I can catch up and we can go from there. Asking permission. Is it okay to keep talking right now, or do you need a break and I can come back? I personally am comfortable with a very, very awkward amount of silence. And the times where I've actually gotten a lot more out of someone because I have sat down and just kind of sat with them and just been quiet. I've heard a lot of really amazing stories from people in that moment. Using supporting statements. So sometimes people are asking questions and they just keep asking you the same question over and over and over and over. Sometimes it's not a cognitive question. Sometimes it's an emotional question, right? Like, what could I have done better? What could I have done? What did I do wrong? What did I do wrong? Right? Most of the time, the family's done nothing wrong. They're asking that because they're just trying to figure it out in their head. It's an emotional question. It's not they're looking for an answer from you. So being able to let them know, like, you did the right thing, right? You brought your son or daughter in as soon as you noticed something was wrong, and you're here, right? You keep showing up. I very much enjoy I wish statements, right? So what do you say when you literally have nothing else to say in a room? Like, I wish you weren't going through this. I wish we didn't have to meet, right? I wish you didn't have to go home and explain this to your other kids. Because those are all truthful statements, regardless of the situation. Even if this is a family that has come in and maybe potentially has, done something, intentionally or unintentionally to their child, these are still truthful statements that you can say. So feel free. That would be a good one to definitely remember. A simple, I'm sorry, I'm sorry that we're here and that this is happening. I did put up a couple nice examples. Hopefully you've noticed some of them are crossed off, right? Like, everything happens for a reason. Like, please don't ever say that to someone, right? Because that's not our place to tell them that. If they at some place want to find that silver lining and say that for themselves, great. But that is not something ever coming out of my mouth to tell them, oh, obviously this happens for a reason, someone had a plan for you. So just being there, being present, you don't always have to have something, epic to say. Being there and being present means a lot for people. So I know this one is hard, but trying to avoid medical lingo. So if you're all sitting talking with yourselves and using the big giant words, right? Or we go to the pediatrician and my husband's there and I ask really nicely for a pediatrician to make sure to explain it to me as well as to him, because she might use different language for him that she's going to use for me. And yes, I know I work in a hospital, but I like it broken down, very simple. So also asking that family, like, how do you take things in? Like, what's the easiest way for you to understand information? Because right there, then you know, right? Do they want everything all at once and they want all of it? Or do they want things kind of simplified out and they want it in pieces? So those are just some hopeful words of wisdom for all of you. If you're not sure, try to ask, engage that family and see what might work for them. Be aware of your own personal feelings, right? Try to not bring those in, even if this is a family making a decision that you don't agree with. I'm sure somewhere in this place, there is a room with a closed door and a friend that you can talk to about that, but not with the family. Sometimes I offer other suggestions from other families, right? Maybe this is a family that they don't know what to do. They don't know what they want, what they need. Well, I've worked with families in this situation, and some families, they choose this and some families choose that. And it just depends what's important for them. Trying to figure out, what's important to you in this situation. What's important to you for me to know in helping care for your child is, you might find out a lot just from that question. Obviously, don't assume everyone's going to react the same. And please don't use any sort of "at least," right? We don't need a comparison. Like, well, at least it's not as bad as it could be, right? I feel like there's a lot of I say this to my 12-year-old too, so it's not just all of you, right? Like, there's a lot of "at least" statements that just don't hit the way that you want it to. And a lot of times you actually mean well, but it just falls flat. So what are things that we can also do, right, to help the family? Preparation. They aren't going to necessarily know what this is going to look like, right? So what can we tell them in advance? Because I can't always stop something from happening, but I could give somebody a warning, right? Maybe their child's breathing is going to change and it's going to be different, right? It might look different. It might sound different. Again, I can't always change that, but I can let them know that this is something to expect. So when it happens, they're not as shocked by it. Encouraging them that if they want to be in the room, if they want to, be holding their child's hand, if they want to be holding their child, if they want to be laying next to their child, that obviously, as long as it's appropriate in that situation, encouraging them to do so, but also being okay if they don't want to, right? I've seen the family that wants to be in the room and there for every single moment. And I've seen the families that say their goodbyes and they leave because they are trusting us to take care of their child and they know that we're going to be there. And so if that's something that we can do to help lessen that burden for them, like, I'm okay with that too. Not everyone's going to react the same. So anything we can do to help create a peaceful environment, if we're able to turn down lights, right? Make it not so bright. If we're able to turn down noises, or put, a screen in front of a room in an ICU so everyone's not walking by and staring in to see what's going on. I know I've spoken on this a couple of times, so I'm not going to hammer it too much, but just remembering grief is really individual, right? Because people are also bringing any of their past life experiences. Maybe this is a mom in the NICU and her and dad have already had several miscarriages or a stillbirth, and now their baby's really sick in the NICU, right? That's going to play into how they're reacting to what's going on. what their support system is, any other current life stressors, right? We don't always know what else is going on at home for a family that might be playing into this. I already had given them a shout out, but just one more for any, any times where we're able to call upon any of our other friends in the hospital to help us. We should not have to do this alone, right? This is hard. So as healthcare professionals, who else can we call to help us and help families? So things that we can help with, right? Continuing bonds are really important when you have lost someone, right? So maybe you've lost someone in your life and you have, I don't know, a piece of clothing of theirs or a piece of jewelry or, my grandma's special ring. Those are all things that people can have that are tangible. What are other things that we might be able to give them, right? This might be, a baby in our NICU who hasn't been home ever. So maybe making these memories might be really, really important. These are actual memories that my good friend Elise here helped make with one of our families who has been kind enough to also let us show them, right? Stuff like this. These are things that people hold on to. I've seen people make like shadow boxes, seen people put up like those floating shelves on their wall or put things on their mantle or put everything in a box and they shove it in the back of their closet and they take it out once a year and look at it. Whatever they want to do with it, if these are things that we can help them get, I think that's really important. So if we can help, call our art therapy friends, our child life friends, depending on where we're at in the hospital, some of our nursing staff is trained really well to help with these when there's not other disciplines available. Grief is not something that we get over. It's something that we carry with us, especially when it's a child. So anything that we can do to help that. I feel like I could probably go into a whole different talk about all of the things on the screen, but just some things to recognize where we might potentially hit some complicated bereavement. So when we have those kids that come in and it's a sudden loss, someone gets an infection and comes in and it goes downhill fast. Any of those traumatic deaths. Personally, I feel like any child death is traumatic in some way to a family, but I'm talking more in this instance about a drowning, a car accident. Unfortunately, if we see, a child who has died by suicide or homicide, any loss history, right? Hopefully this does not happen, but I have run into a family who's losing a child who's already lost one, right? Like that's going to complicate things. So again, to review, what are things that we can do and what are things that we can help? So before death, right? Communication or language, things that we can help prepare a family for, identifying potential helpful support. Maybe this is someone who is, a parent who's here by themselves. There's someone we can call, right? Do you have a sister? Do you have a friend? Do you have an aunt? Is there somebody that we can call to be with you so you're not leaving this hospital by yourself? The memory making that I talked about, calling any of our interdisciplinary team members that are available to us. So once that family leaves and goes home, then what? How do we provide that continual support for our families, right? Well, if you're the pediatrician in the community and they're bringing in the sibling, asking, like, how are you doing? Using their child's name. I am still thinking about your child, right? And if they say thank you and they don't want to talk about it, that's okay, right? You acknowledge their child, but there are parents that would, I'm telling you, be so thrilled that someone mentioned their child's name and actually asked how they were doing. Being able to listen and then also being able to offer resources and support. If their other, child is struggling, how do we help them? Right? Because this parent's also trying to help themselves and help their child. So are there things that we can do to help them? So in the back, I have like these tiny little cards. We were working really hard to basically take all of the resources I have in my brain that I've been doing research on and put them on a link tree. And that is something that we can give to families. And I am giving it out, but it's also something for all of you. I have a ton of resources on there. So these are not resources that everyone needs to memorize and know how to get these to families. These are things you can send me a family. I will help them find the resources that they need. Sometimes it depends on the type of loss as to the type of resource that might be appropriate, but there are resources out there. There are things that we can do to help families after the fact, whether that is individual counseling, a support group, maybe it's connecting with another family, right? Someone else that is understanding what they're going through. So I realized that I started this earlier in the year and probably haven't made as big of a deal about it as I should have. All of our families in Rainbow, whether I have actually physically seen them or not, because I am one person and cannot get to every single person in the moment. We have started from our parent bereavement programs sending a sympathy card. So that way I know, regardless if someone else in the hospital might send a card or might call or might do something, I know that all of our families are receiving a sympathy card. Also a letter at 3 months, at 6 months, that's written by another mom, a letter at 9 months, an anniversary card, and then a birthday card. So things that basically are just saying, like, we are thinking of you. We are still here. We still care, right? Because we do. I know that unfortunately children pass away in this hospital, but then how often is it that, a few hours later, there's another kid in that bed and you all have to take care of them, right? So these are things that I can do to help follow up with families. And the times that I've gotten responses from this so far has been really positive. Like, thank you for reaching out, and being able to talk and connect and get them resources if they need them. The final thing that I will mention also is also talking about, remembering their children and being able to honor that. Is last year I started our first Remembrance Walk at the Cleveland Zoo in July, because it's Bereaved Parents Awareness Month. And we had 477 people show up and remembered 76 babies and children. That's huge. This year, like, okay, obviously we have to do that again, right? 768 people. We remembered over 113 babies and children. This is something special for our families, but it's also something special for our staff. So I encourage you that when you see this come up for next year, families actually appreciated seeing staff, connecting with staff, being able, to remember their child and see someone that was there and that cared for them. So please, don't be worried that a family might not want to see you or might not want to talk to you or scared. If they're coming to an event, they want to see you. So this, I think, speaks very well to wrap up what I am saying, is that grief does not shrink over time. We learn to grow around it and carry it with us. So anything that we can do on our end to help people start on that journey is so impactful. So I will take any questions that anyone might have or comments. Also happy to chat offline too for anyone.
I'm standing away so we don't get feedback. It's not that I'm running away from your talk. It's your subject. And if, I'm going to remember what Robert told me. We've gotten some feedback from folks online that when we ask questions, if you going down here, people online can't hear you. So just prompting that as I pass this around, please hold it up close to your mouth so that we can share the conversation with our folks online. Boy, I have so many. The follow-up I think is amazing. Not going to make it about me, but even just having lost the dog and getting a card from our vet and saying,
yes,
hey, checking in with you. And we've made it, they all came from the same vet school. It's a freaky thing in that practice, but we've made a donation on behalf of your pet to a project that happens to be run at their vet school. Completely unexpected and so meaningful that somebody still remembered to reach out. Let's turn it into a question. It's awesome that you and your team are doing this for us as physicians.
Yeah.
How far do you extend? Do you have any coaching on how far to extend that we personally reach out and keep in touch with families? And is there an appropriate statute of limitations on that?
Right. Um, eh, that's a hard one, right? Because I feel like it depends, right? We need to maintain good boundaries for ourselves as professionals. So I would never want someone doing that, at their own expense because it's taxing, it's hard. I'm hopeful that we can continue to build upon like our support programming and be able to offer more remembrance events. I think that's a safe place to meet up and talk with families. I will also say that maybe for a family that you've been really close with and you were one of the people there in that moment, I've had some really wonderful attendings that have offered, if this family wants to come back and meet after the fact and re-go through what happened, and go over autopsy results or go over, all of that. That's something I can help do. I feel like if you aren't sure, you can always reach out. I'm happy to talk through like um, specific instances with people. I will say for like our pediatricians in the community, I think if you know that one of, the kids that you're following has passed, being able to call that family and reach out, I think so impactful, right? Because you're the one that's been caring for them. If they have siblings, they're going to still come back to you. So that I would say is completely appropriate, even if it's, a phone call right away, a card, maybe even just like once every few months, just to check in, right? Because I do that all the time. Like, hey, how are you doing? I'm thinking of you. And some people are fine, and other people, it's like an hour-long conversation and they need things and they're not calling. So
There's a question on the web about resources. Do you have any books you can recommend?
any
Books?
Oh, books. Yes. So, so I have a bunch. I wish there was a way to send them to all my online friends. So there is, hopefully if you Google Linktree parent bereavement programs, we put together an entire Linktree and there's actually like a PDF version of all the books that I would recommend, on there versus please feel free to email me and I can send you some. One of my definite favorites is Alan Wolfert. I always mess up his last name. He has like 100 Ways to Heal a Grieving Heart, but he has a book for parents. He has one for grandparents. He has one for kids, for teenagers. He has one for traumatic deaths. Honestly, I think there's like 20 different versions. So that's one of my favorite books that I would recommend because each page is a different thing that you could do, right? Like plant a tree, sit down and cry, call a friend. There's a lot of kind of things that might be easy to think of if you're not grieving, but if you are grieving, it's really hard to think of, what's an easy way that I can accomplish, having my feelings today and making space for it.
I reflect that I am not in the emergency room. I'm not in the ICU. I'm not in the high risk zones. And so I have been in this scenario. I'm going to add it to your traumatic death list.
Yeah.
There's my child was snatched from me in a car accident.
Yes.
Then there's they participated in the decision to say goodbye, turning off support, letting somebody go. And I'm wondering if you have some coaching around how to help families with that. So again, I'm making this about my personal experiences. The guilt that comes afterwards. Did I make the right decision? Did we wait too long and they suffered? Did I make that decision too soon?
Yeah.
But certainly I went to med school and did my training in a very paternalistic era of I will tell you when it's time to turn off the support. And I think appropriately we pivoted towards much more shared decision making, but that comes with the burden of that decision.
Correct. Because in those instances, right now, the family is carrying that. A lot of times, honestly, I'm talking with them and I'm giving them space to say those things, right? Because you always have those like, what if I would have waited a few more days? What if, I hadn't listened and I went and got a second opinion? Honestly, sometimes it's just listening, right? Because you can't go back and fix it, but you can talk through it. Because if you don't talk through your feelings, what happens, right? Like you shove them all down and then they like stay down there, right? No, like they bubble back up and like they explode in your face, probably at a really inappropriate time. So again, like creating that space to talk through it. And if you are, pediatrician, or maybe you're one of like our specialty, physicians, seeing someone in a specialty clinic, being able to still have space for that and offer, if you want to talk through this again, like I'm here, like we can set up an appointment and you can come in and we can re-talk through what happened. Because it might be that it happened so fast that they are questioning, did I do that correctly? Did I make the right decision? So I honestly, anytime I've seen one of our physicians do that, offer for a family to come back in and sit and talk through something, it means the world to the family. And you're able to take that hour, out of your day to do that for them. It's huge.
Hi, more, I guess, related piece of feedback in response to working with a family who had lost a child. I'm with the social work department. Something that I had noticed is that families really seem to take notice to providers who had said hello to them, who had worked with them previously, even if they weren't part of the care team, but just knowing that they're still in the hospital system. So even if you're not, an outside clinician, who's a primary care provider, sending a card or something like that, if you still work within the hospital network and you know that the family is in for another reason, making a point to even say a quick hello, I think goes a long way too.
Yeah. Thank you. I would agree with that wholeheartely, because we never know the impact necessarily we're having on our families. And I've had several families that have said, oh, like we were back in for something else and I feel like so-and-so avoided me. And it might not be that that we avoided them, right? It might be, oh gosh, this is awkward. Do I say hello? Do I not say hello? Am I supposed to be like interacting with them? You can always say hello to someone and they can ask you to leave, right? Like I would rather say hello to a family and have them ignore me, which surprisingly has not happened to me. But kind of giving them that choice. And especially for like some of our, like consulting providers, like I've had families that have told me that they really appreciated, that the pulmonary division sent a card, right? And so it might seem like something small, but it's huge. I have families that hold on to those things, and I have families that can tell you every single specialty that sent them a card and the one that didn't. That 6 years later, they are still holding on to that.
Thanks, Allison, for all this. One question that I'm asked a lot by people, and I'm sure you're asked too. Could you speak to going to funerals and if that's appropriate?
If I am invited specifically by a family and I can go, like I go. Could I potentially go to every single funeral, being that all I do is bereavement? Likely not, but if it is a family that you have a strong connection with, they appreciate you there. I had one very awkward funeral that I actually did show up to. His the dad had left or thought he left something, and I was bringing it to him. Like the entire like procession line stopped, looked at me, and like let me go all the way to the front to see this dad who like was smiling because he was so excited because I showed up and I had the item he was looking for. So for me, I was like, oh gosh, there's so many people here. This is so awkward. Maybe this isn't the right time to bring this. And it turned out to be, like his mom hugging me and thanking me for showing up and bringing this item that they really, really needed. I think sometimes the awkward part is more on us than on the family, but I've had families that have had a lot of comfort in having the hospital staff actually show up because they feel like we're their family just as much as their blood relatives, because we were the ones that were here. We were the ones that were helping care for them in the moment. So other people might disagree, but I think it's okay.
We're at the hour, so I don't know if you have a few minutes afterwards. If there are people who have more private questions that they want to bring to the front of the auditorium, I'll invite you to do that. But how about one more round of applause for